Hello doctors, this is the time where you're going to be very active, very productive, and also you're going to be more concentrated towards your revisions. As the exam is approaching, let's revise the contents quickly and let's dive into the lectures. Now look at this beautiful eyes here, but you're going to focus on the FMG contents for upcoming July exam. Let's revise ophthalmology. Cornea. Cornea has how many layers? It has 6 layers. Yes, this is going to be what? Cornea. It has 6 layers. Let's revise one by one. Now, the first layer is called as what? Epithelium. Yes, this is called as what? Epithelium. Very good. Therefore, the inner layer is going to be called as what? Endothelium. This is called as what? The pinkish one is called as what? Endothelium. Now, you just have to remember the layers inside. Let's go. This one, the purple one, this is called as what? Bowman's layer. And this layer over here, this is called as what? Stroma. Yes. Right next, the green one is called as what? Descemet's membrane. Just before this is going to be what? The Dewars layer. Yes. Dewars layer. And then we have the endothelium. Quick revision, we have epithelium and endothelium. In between we have what? Bowman's membrane, then stroma, Dewars, and then Descemet's membrane. At last we have endothelium. That's it. As simple as it is. Lens is a very important component of the eye. It is going to be biconvex in shape. Biconvex in shape, yes. Remember, the anterior surface is less curved than the posterior question. Remember, the refractive index of the lens is going to be what? Nucleus is going to be 1.40 and cortex is going to be 1.38. Opacification of lens. Remember, opacification of lens is called as what? Cataract. Look at the normal eye, it looks very beautiful, and look at the eye with cataract. What happens is that the lens becomes cloudy. In cataract, remember, the lens becomes cloudy, it is not clear. Now, what is the image here? This is going to be bluish color, therefore it is called as what? Blue dot cataracts. Next, rider's cataracts is going to have spooky wheels like the bikes, so this is called as what? Rider's cataract. And this we have rosette cataract. This is called as what? Rosette cataract. Let's revise this PYQ question. Which of the following cataract seen in blunt trauma? It is going to be rosette cataract. Very good. Yes, this is the answer. Look at this cataract here. This is called as what? Oil drop cataract. This one is going to be sunflower cataract and this is going to be Christmas tree cataract. Now, remember, oil drop cataract is seen in where? Galactosemia. Galactosemia. Yes. Next, we have sunflower cataract which is seen in Wilson's disease. It is seen in Wilson disease. Yes. We can also see what? KF ring. Very important. Next, we have Christmas tree, which is also seen in where? Myotonic dystrophica. Myotonic dystrophic. Also, we can see what? Christmas tree cataract. Yes. Post-op endophthalmitis has been asked in the exam. Let's revise it straight away. This is the image of what? Post-op endophthalmitis, and we can also see what? Hypopayon. Yes. Now, what we are going to give? We are going to give intravitreal antibiotics as prevention. Remember, to avoid the post-op complications, we are going to give 5% povidone iodine as topical. Yes. Very important. Next. Late post-op complications could be what? Most commonly caused by Propionobacterium acne, which is a fungi. Question. Next, complication. The post-op complication can also lead to what? Posterior capsular opacification, which is also a very important question. Now, let's revise bullous keratopathy. What is bullous keratopathy? Remember, in bullous keratopathy, the cornea, the clear cornea, it becomes what? Hazy. It becomes hazy, and if you zoom inside slightly, you can also see what? Blisters. Blisters on the epithelium is seen where? Bullous keratopathy. Now, you have to remember 3 important points. That is going to be posterior capsular opacification, PCO. Remember, posterior capsular opacification, and also remember Helschnick's pearls and also Sommering pearls. These are very important points. Let's revise once again. In bullous keratopathy, look at this is going to be what? Bullous keratopathy having hazy cornea, and also we can see blisters in the epithelium. Now, 3 points is going to be posterior capsular opacification, Helschnick pearls, and also Sommering pearls. This is the image of what? Keratoconus. Yes, to measure the thickness of cornea. What is it called as? It is called as what? Pachymetry. Yeah. Now what is this instrument here, sir? This is called as what? Keratometer. And what is it used for? It is used to measure the curvature. Remember, it is used to measure the curvature of cornea. Retina. Retina has 10 layers. How many layers does cornea have? Try to comment your answers. Now, we know that it has 10 layers. One layer is going to be what? Retinal pigment epithelium. And then we have 9 neurosensory layers. Yes. Now, let's revise. What is this one? This is called as what? The ganglion cells. Here we have the bipolar cells. Here these are called as what? The cones. And here we have the grayish one, the rods. Now, remember the detachment between RPE and the 9 neurosensory layers is called as what? RD. It is called as what? Retinal detachment. Please look at the image carefully. Yes. The detachment between RPE and the 9 neurosensory layer is called as what? Retinal detachment. For the exam, you are going to remember most radiosensitive layers are going to be what? These ones. Rods and cones. Rods and cones are going to be most sensitive to radiations. Yes, rods and cones. Question. Now, also remember, most radio resistant layer is going to be the ganglion cells. Yes, remember, these ganglion cells are going to become what? Radio resistant. Most radio resistant are going to be ganglion cells. Yes. Retinoblastoma. The word itself says it has to be connected with retina and oma. Oma means what? Cancers. It is the cancer of what? Retina. Cancerous cells seen in the retina is called as what? Retinoblastoma. Yes. Now, it is the tumor of primitive cells of the retina. Remember, it is classically seen, usually seen in 3 to 5 years old child. Remember, 3 to 5 years old child, and RB1 gene. Remember, RB1 gene and chromosome 13q14. What else we have to remember? We have to remember Flexner-Wintersteiner rosettes. Very, very important. This is what? Flexner-Wintersteiner rosettes. And then you're going to see cottage cheese-like appearance. Remember, cottage cheese-like appearance is seen in retinoblastoma. What are you going to remember? Very easy. It is going to be seen in 3 to 5 years child, and then it is going to be seen where? It is going to be having RB1 gene, chromosome 13q14. We are going to remember also Flexner-Wintersteiner rosettes and also cottage cheese appearance. Yes. What is the most important step in prevention of endophthalmitis after cataract surgery? We just talked about endophthalmitis. Option A, intravitreal antibiotics, povidone iodine lead cleansing, post-operative antibiotics, or trim eyelashes pre-operative. What is the answer here? It is going to be povidone iodine lead cleansing. Good. Drug of choice for primary open angle glaucoma is going to be what? Look at the options. Try to comment the answers. It is going to be prostaglandin. 3-year-old child presented with cataract. What will next step of management? Your answer is going to be what? Remove the cataract for the baby and then do primary posterior capsulotomy. This has been asked in the exam as well. Cystoid macular edema, it is going to be accumulation of fluid in the outer plexiform layer. Yes. Loss of inner blood retinal barrier is also going to be there, with multiple cystoid areas of fluids is going to be seen as well. These are going to be what? Multiple fluids. Now, this is how it looks in the OCT. Also remember, what is the reason for cystoid macular edema? It is due to what? uveitis. It could be due to diabetic retinopathy, or it could be also due to Irwin-Gas syndrome. Please remember Irwin-Gas syndrome. Now, what is the treatment for cystoid macular edema? It is going to be intravitreal steroids. Yes, intravitreal steroids are given for cystoid macular edema, or we are going to give intravitreal anti-VEGF injections. Yes, this is the image of what? Please remember this is going to be cystoid macular edema. Look at the image of this patient who is having redness in the eye and also presents with history of what? Gritty sensation, or it could be also what? Foreign body sensation. Our skimmer's test value is also only 5 mm in both the eyes. The examiner has already given the clue. In both the eyes, the value is just 5 mm. It is going to be purely what? Dry eye. Yes. Normal value would be what? 10 to 15. It is considered what? Normal. So, since she is having dryness, what we are going to give? We are going to give lubricants. Very important. Usually we give carboxymethyl cellulose. Yes. Now, this test is called as what? Skimmer's test. Yes. As we are approaching towards online studies and usage of more mobiles, it is very common for people to have dryness. Therefore, if you have dryness, what you're going to do? You're going to give warm compression. You're going to give what? Warm or cold compression. With a clean cloth, you're going to apply it in the eyes. Yes. Next, you can also use what? Artificial tears like carboxymethylcellulose, or you can even use what? Sodium hyaluronate. Next, we have to wear sunglasses. Yes, it is very protective for the eyes. Nowadays, everybody rides bikes, and then there's going to be plenty of air striking your eyes. Therefore, it is better to use what? Sunglasses. You can also stay hydrated. Yes, drinking plenty of fluids will also help you. What is a part of the treatment for dryness? Yes. Please observe all these images carefully. Now look at this cornea. It is going to be greenish color. Yes, this could be due to what? Pseudomonas. First point to remember, could be pseudomonas. It could be caused by what? Because of prolonged contact lens wearing. And remember, it can also lead to redness. Yes, the conjunctiva is already red, and the patient may suffer what? With photophobia. Yes. Now look at this image over here. Again, the eye is reddish, and you can see something particular. We can see something called as what? Satellite lesions. Yes, and the patient is also having what? Hypopyon. This could be direct itch by vegetable. This has been asked in the exam, and that is due to what? Fungus. It is due to a fungal ulcer. Yes. If you ever happen to see a structure like this in the exam, please mark it as what? Viral keratitis. Yes, this is going to be what? Viral keratitis. And which virus is it, sir? It is going to be HSV. It is herpes simplex virus. Very important. If you ever see a patient's eye having foamy white spots on the temporal conjunctiva, it is called as what? Foamy white. Foamy white. This is going to be what? White touch spots. Yes. The patient is having deficiency of what? Vitamin A. It is called as what? Xerophthalmia. Yes. Now, which anti-tubercular drug causes red color vision defects? Red color vision defects or optic neuritis? It is going to be ethambutol. Yes, this is the tablet which is going to cause red color vision defects or optic neuritis. Question. Concentrate on the eyelids here. Yes, patient having itching and redness, mostly seen in summer times. He or she complains that mostly in summertime. There you're getting a hint. Along with ropey discharge. This is going to be what? Spring cataract. Very important. This is called as what? Spring cataract. It is also called as vernal keratoconjunctivitis. Question. Now, in the second image, you are seeing big, giant papillae greater than 1 mm. This is going to be what? This is called as giant cell papillae. This is caused by contact lens or an artificial eye. Yes. If you see papillae greater than 1 mm, it is going to be what? GCP, giant cell papillae. Now, this is going to be image of what? Chalazion. Yes, this is going to be chalazion due to blockage of what? Oil gland, which is called as what? Meibomian gland. Yeah. However, doctors, this is purely for those students, your juniors, your friends who are going to appear the December 2024 FMG exam. Dr. Bhatia is gladly announcing our offline sessions in Hyderabad starting from July 15th. Dr. Sakshi ma'am is going to be on July 15th here, and she is going to be the mentor for the upcoming batch along with Dr. Sushil sir. Sakshi ma'am and Sushil sir will be guiding you throughout this journey for the 6 months along with the national faculties. All these faculties will be there to make sure that you are guided well. They will put all the efforts to also to give you the best to make sure that you are going to clear this exam in December. Looking forward to see all the students who are going to appear in December on the board. Thank you. Iridodialysis. Now, first let's look at the normal eye. We have the pupil and the iris. What happens in iridodialysis is going to be the iris is going to be detached from the ciliary body, making it D-shape. If you ever happen to see a D-shaped iris, it is going to be what? Iridodialysis. Yes, it is due to separation of iris from the attachment of ciliary body. Question. Next, secondary to the blunt ocular trauma. Yes, it happens because of what? Ocular trauma. It could be also because of what? Intraocular surgeries. Now, it can cause what? Patient may present to you with what? Diplopia. Yes, this is how it's going to look like. Remember D. D for what? Iridodialysis. Yes. Now, inflammatory cells lying at the pupillary margins can be seen here. If you ever see like this is called as what? Coipes nodules. Coipes nodules. These are going to be what? Inflammatory cells, especially lying at the pupillary margin. If you ever see, this is the pupillary margin. These are the inflammatory cells. This is called as what? Coipes nodule. Let's revise PYQs. A 6-year child taken from cataract surgery. Let's revise a PYQ. Let's revise a couple of PYQs. A 6-year child taken for cataract surgery. As he grows, which parameter should be considered? It is going to be what? Myopic shift. Yes. Most common cause of pediatric blindness. Very easy one. I hope everybody get this answer. What is this? This is going to be vitamin A. Yes. Pterygium is a very important topic to study. It is going to have what? Wing-like shape. Beautiful. If you ever see this, please mark it as what? Pterygium. Yes. Now, what is pterygium? It is a fibromuscular growth of conjunctiva. Of what? Conjunctiva. It is going to be wing shape. What is the treatment, sir? Surgery. You are going to do conjunctival autograph. Conjunctival autograph. Yes. Especially from the other eye. Good. Remember, if pterygium just on the limbus, if it is just on the limbus, what you're going to do? There is going to be no treatment required. Yes, this has been asked in the exam. Pterygium just at the limbus, no treatment is required. Yes. Yes, doctors, what do you see here? This is called as what? An instrument having pin-sized hole. Therefore, it is called as what? Pinhole. If a patient's vision improves with a pinhole, what does it deficits? A patient's vision, that is acuity, visual acuity improves. It means that the patient is having what? Refractive error. Question to remember. Yes. Is it a magic that when you place the pinhole, the patient's vision improves? What is the science behind it? Let's see. Now, it eliminates the other light rays passing through the nodal point of the eye, and it reaches the fovea, thereby improving the vision. Yes, this is the mechanism behind what? Pinhole. Yeah. Now, remember biconcave lens. These biconcave lens are actually given for whom? For myopic patients. What is this image here? We can see that the eyelid has moved inward. Therefore, it's called as what? Entropion. Inward. Entropion. Whereas here, the eyelid has come outward. Outward lying is called as what? Ectropion. Good. Now, what do you see here? We are seeing inward growth of the eyelashes. Inward growth can cause what? Irritation to the eyeball. Yes. This is called as what? Trichiasis. Unluckily, a guy fighting with girlfriend, he comes with painful ocular movements and non-reacting people. What could be the diagnosis here? Remember keywords, painful ocular movements and non-reacting people. This could be what? Optic neuritis. Yes, this is how it looks like. Now, what is optic neuritis? Let's revise. Remember, it is what? It is going to be inflamed optic nerve. Therefore, there is going to be what? Inflammation of the eye, which is leading to what? Optic neuritis. Yes. Wilson's disease. We have already discussed about this. What is going to have? KF ring. Yes. What is this ring called as, sir? Kaiser-Fleischer ring. Very good. This is due to what? Copper deposition. Both are questions. Yes, this is due to copper deposition on which membrane? Descemet membrane. Yes. Now, what do we see here? This is going to be called as what? Anterior staphyloma. It is abnormal protrusion of what? Uveal tissue. Question number 1. Mostly blackish due to the inner layers of the eye being affected. Due to what? Inflammatory or degeneration of the cornea or sclera. Yes, please remember anterior staphyloma. Very important. What is this instrument here? This is called as what? Goldmann applanation tonometer. It is the gold standard for what? Measuring IOP, intraocular pressure. What is the normal IOP? 10 to 21 mm Hg. Anything above 21 mm Hg is going to be what? Glaucoma. Good. Now, what is this instrument here, sir? This is going to be called what? Kerrin sponge. It is used what? In dacryocysto-rhinostomy. Yes. A boy got punched in the eye. Don't know the reason, but got punched in the eye, and the X-ray, you see the sign. What is this called as, sir? This is called as what? Teardrop sign. Beautiful. Now, let's see what the question asks us. A boy gets punched in the eye. What is the diagnosis? Subluxation, inferior orbital wall fracture, medial wall or lateral wall. What is the answer here? It is going to be inferior orbital wall fracture. Next, corneal transparency. What is this? Corneal transparency is maintained by what? It is maintained by keratin sulfate. Yes, you guys are doing good. Trachoma is a very important topic. You have to know this topic, please. Yes. Now, what is the organism causing this? Is going to be Chlamydia trachomatis. Question 1 to remember. Next, what do you see here? This is called as what? Als line. Very beautiful. Yes, this is called as Als line. Yes. And you're going to remember with two mnemonics. One is called as what? Fisto, and another one is going to be safe. Let's go. Now, what is Fisto? We're going to see follicle in trachoma. Next, we're going to see inflammation, scarring, trichiasis, and opacity. Let's revise. Fisto, F for follicle, I for inflammation, Fis, S for scarring, T for trichiasis, and O is for what? Corneal opacity. Opacity, which is going to be corneal opacity. Yes. Next, what is the treatment, sir? Comes with the mnemonic safe. Yes. S is for surgery. A is for antibiotic. F is for facial cleanliness. E for environmental changes. Let's go. Safe. S is for what? Surgery. A is for antibiotic. F is for facial cleanliness. E is for environmental change. Yes. Glaucoma is a very important disease of the eye. What is glaucoma? Let's revise. Now look at the image here. High pressure inside the eye leads to what? Increase in the IOP. Yes. Second, it could be also due to what? Optic nerve damage, or it cannot be also due to visual field defect. Let's revise. Glaucoma could be due to what? IOP, increased IOP. Second, optic nerve damage, and third, visual field defects. Yes. Now, question which has been asked was, depth of anterior chamber reduces in which condition? Open angle glaucoma. Yes. Now, drugs used for glaucoma is going to be very important. Let's study them now, straight away. Glaucoma drugs. Yes, it could be used for what? To decrease the aqueous production. Yes. Or it could be helpful to use what? Increase the trabecular outflow, or to increase the uveoscleral outflow. Good. Now, what are the ocular beta blockers? We all know beta blockers ends with lol. Let's see the lols. We have timolol, bitoxolol, cartilol, or levobinolol. Yes. Carbonic anhydrase inhibitors are going to be ending with mide. Yes. Beta blockers ends with lol. Carbonic anhydrase inhibitors ends with mide. Acetazolamide. It could be brinzolamide or dorzolamide. Yes. What are the cholinergic drugs? It is going to be pilocarpine, physostigmine, or ecothiopate. Yes. Prostaglandin analogs are going to be ending with what? Prost. Easy. Prost. Latanoprost, bimatoprost, and tafloprost. Very good. Beta blockers ends with lol. Carbonic anhydrase ends with mide. Next, prostaglandin analogs end with what? Prost. Good. Now, what is this? Brinzolamide. In which group of drug is this? Mide. It is going to be carbonic anhydrase inhibitor. Beautiful, doctors. Look at the colorful and beautiful images here. Very beautiful, but sometimes could be confusing. Let's get clarified straight away. If you ever happen to see this cherry red, a cherry red spot, in which condition are you going to see it? We are going to see it in CRAO, central retinal artery occlusion. If you ever see splashed tomato sauce appearance, splashing of tomato sauces, this is seen in which condition, sir? It is seen in CRVO. Yes, question to be remembered and question to be remembered. This fluorescence angiography image has been also asked in the image. Please revise properly. We are very happy to announce the starting of FMG batch in Hyderabad, Padmarao Nagar. DBMCI is launching its FMG sessions now with mentorship by Dr. Sakshi ma'am and Sushil sir. They will be throughout the journey guiding the students to clear this exam along with all best national faculties. Starting from July 15th, 25th and August 1, kindly please tell to your juniors and spread the words. Thank you. Yes, doctors, now we are getting towards the end of the marathon race. Now, this is the time where you're going to sprint. What? You're going to sprint. So, therefore, stay motivated, courage. Doctors, so right now we are in the end of the marathon. This is the time where you're going to sprint like anything. You're going to use all your energies. You're going to use all your memory powers. Recall all the contents. Revise properly and consciously. Remember, a good sleep is very much important. Take a nap of 7 to 8 hours. Very good nap so that you can be more productive for the next 16 hours. That is very important. So please stay strong. You have the ability to crack it this time and you guys will. Therefore, stay happy, study, keep revising and stay motivated. If anybody requires a PDF, again, message me in Insta or in Telegram. We'll send you the PDF. Keep revising, doctors. All the best. Thanks a lot.